I couldn't work. I couldn't sleep. I would wake up at night in pain. It wasn't an immediate, all of a sudden it's bad. It would catch sometimes. And I'd gone in about 4 or 5 years ago about that, and he said, oh, you have some bone spurs, and someday you'll need a new hip. And I thought, that's for old people. Yeah, I don't need a new hip. I think what I was worried about was losing control of my life, losing independence, thinking that it would be so hard and I would have to ask for help. I'm pretty independent. I needed to decide how long I could be off of work, and then I had to figure out how to manage just being at home. The only big change I had to make was getting the thing for the potty. That was fun, the elevated potty seat. And I had to figure out how to let my dog in and out because the back door is down 4 steps. The surgeon I picked was really respectful of my fears, understood that I wanted it to last, that I didn't want to have to get my courage up to do this again. And then he helped me make the best decision. I said, you know, I'm really having a hard time with this. I'm having a hard time thinking about you cutting my bone off, and what if you get it wrong, and what if it's too short, or what if it's too long? And he said, that's everybody's fear. He totally gets it. He would be afraid of the same thing. It was much simpler than I ever thought. I really thought it was going to be difficult, but I had no pain in my joint at all. The pain that I had from the incision and just from being uncomfortable was nothing compared to what I'd lived with for way too long. I think the hardest part was getting used to limits of movement. You know, you can't cross your leg a certain way, you can't sleep a certain way, you have to get up slowly, and I'm a pretty fast-moving person generally. So learning patience was tough. Accepting help was tough. Oh, I was out walking around the track at the park by my house at a couple weeks. I could do anything. I just feel wonderful.